When ordering a skin test, you can quickly select the template for the test protocol you want to order for the patient. You can also select from your pre-ordered panels and dynamically add or remove antigens as the patient history may dictate. The freedom to rapidly select your typical panels, but adjust on the fly in a graphical layout, allows you to efficiently provide care tailored to your patient. Built-in timers can allow staff members to monitor multiple tests simultaneously, making them more efficient. Test interactions are automatically logged and appended to the results for full transparency to the provider. Staff can document directly into the provider's skin test template with provider-specific controls that are highly customizable. An example is mitigating antigen scores without documenting controls to help avoid having to retest a patient for something as simple as a forgotten control. The system adapts to the provider's approach to scoring and offers decision-assistive defaults for reactions and can be tailored to positive or negative determinations, the traditional 3+ scoring system, or any other complex methodology. Direct entry of results with the large touch panel helps to mitigate the risk of time and transcription errors while providing real-time feedback to the nurse. Prescribing an extract can be triggered directly from the skin test. Profiles are a way for the providers to store all of their default preferences for a prescription, streamlining the prescribing process. These include the concentrations, default doses of antigens, and diluent types. Formulations can be created manually while reviewing the provider's curated list of extracts typically prescribed from, or, with a couple of selections, all of the antigens fitting the provider's definition of a positive can be added to the prescription. Controls can be set up to warn for conditions that you may want to flag before proceeding, like incompatible antigens being included into the same treatment set. This approach allows rapid creation of patient-specific treatment sets with warnings for common prescribing errors. Selecting treatment plans and leveraging a configurable status progression for the treatment sets can ensure that patients' care initiation is seamless. The dashboard list of queued prescriptions allows providers to review pending orders, back-office staff to access, review, and notate for any billing verification or additional back-office work. The summary allows for an at-a-glance review of the orders, and ready access to notes and edit features makes it an effective place to review and manage the queue. Mixing staff also find this view helpful to quickly review and prioritize work during the compounding process. This creates a centralized place to help mitigate orders getting lost in the process, allowing patients' files to be ready before reporting for injections, and providing oversight to workloads in the back office. After reviewing the prescription in the queue, mixing staff can select antigens directly from the list view or with a barcode scan from prepared documentation. Sorting and filtering of status helps keep orders in sight and compounded in the appropriate order. The mix supports process and documentation requirements such as confirming selection of the correct concentrates, documentation of the lot number and expiration dates of the stock used, and systemized process for dispensing. Inventory is scanned as it's selected from trays and offers a verification that the correct antigen is selected, which can help mitigate compounding errors. Alerting will halt a user from proceeding with the compound until correct antigens are selected. Real-time alerting will stop a user from dispensing outdated extracts and alert for various inventory conditions like short-dated vials or low-volume antigens. The barcode scan also documents the lot number and out date of the selected aliquot, mitigating the need for any logbooks or secondary mixing records, focusing nurse time to patient care. Upon scan of the final prescribed extract, the user is automatically taken to the dispensing screen where they can document each step in the dispensing process. This allows the provider the ability to determine if the entire treatment is dispensed completely and accurately. Labels and documents print automatically immediately after dispensing, saving staff time, typically wasted in the download and print clicks required to send a document to a printer. Suggested charges post back to ModMed with the PDF result of the mix event for the provider to review, saving time in manual documentation of labels and mix activities. The injection dashboard provides a real-time waitlist of patients waiting for an injection or waiting to be excused. Staff have an immediate sense of the patient load, can pull and prepare vials before walking to a clipboard in the lobby, and address situations without exposing the patients to issues finding serum or treatment questions. This improves the patient experience and saves staff time and embarrassment in front of the patient. The workflows can be configured to balance the safety checks and efficiency in the injection process. Questionnaire lockouts can ensure patients who are not indicated for care don't inadvertently proceed. At time of the injection, the tile will present the designated dose for the injection that is due that day, based on the customized treatment plan. Premature or delinquent injections are flagged, and dose reductions or injection lockouts for late shots, recent local reactions, or some combination of both combine to present your defined dose by default. This can help to support more complex decisions surrounding injection dosing. The resulting report has flexible templates to allow easy access to results transferred to the patient's chart in EMA and specialized printable summaries for the patient. The suggested billing will also post directly to the bills and claims in ModMed, where it can either be automatically billed or queued for triage after being reviewed and approved by the provider. This allows your staff to focus on other tasks, as there is very little additional time required to document and bill tests.